any disalignment of this posture is not only affecting the shape and we're going to see deformity, but also is going to affect the function. Starting from the controller system, which is the nervous system, either somatic or autonomic, and also the endocrinal system. And this force, which is the acting upon our body, we have our own muscular force, internal force, and we have external force in terms of the gravitational force. How we balance between the internal force and the external force in order to keep the upright posture of the body, not only looking for the normal appearance, but actually looking for the homeostatic function of our body in order to get the full outcome, which can serve as a safeguard against any injury later on. So physical therapy, the exercise and the physical agency, like agents like heat and cold, therapeutic current, it changes our body physiology. So whatever happened in the physiology, we can recover, we can revise, we can reverse this change through physical and exercise. So if we're looking into our systems, we're looking to the controller systems, the nervous system and the endocrinal system. So we can affect both systems through the exercise and through the physical agent. And also, these two systems is going to affect the other organ in our body. So looking at the physical therapy technique or the manual techniques, which we can help, it can help a lot during this crisis. Number one, we have the craniotherapy. The cranial osteopathy, this is a special technique which using the hand the cranial osteopathy, it's a cranial technique using our hand to diagnose and to treat under the crisis condition, under the war now going on in Gaza, and under any severe stress condition, under any trauma. So the dural tension, which affecting the nervous system, either the central nervous system or the peripheral nervous system, so we can release this tension through certain cranial technique. And it's nowadays, the research is going on as there is contradiction regarding the evidence base regarding these techniques, but regarding the clinical trials right now and the case studies now, it's a promise result and outcome which can help a lot during the crisis we live now. Also, regarding the osteopathic manipulative technique, the philosophy of osteopathy that this kind of paradigm on the manual therapy acknowledge that the living body, our body, has its own power, its own renewing, regeneration, and recuperating system, which maintains the healthy constancy through the life. And whenever any disturbance, any compromise happen in this regulating system, innate system inside our body, so we're going to see the symptoms, the signs and symptoms develop. So osteopathy is concerned not only with the signs and symptoms in the conventional medicine, but it is concerned about the root cause of these symptoms, how these symptoms comes out. And during the crisis, during the extraordinary stress, which the people, our beloved brother there in Gaza lives right now, so there is a change in this regeneration and renewing system, which affecting many trauma they suffer now, in addition to the physical trauma happened due to bombing and destruction of their homes. So in order to incorporate this, so we talk about the cranial osteopathy, and we have the second technique. Actually, we add, in addition to the cranial technique, we add the sacral technique. And we can combine both techniques together to get more and more. And if you just looking at the craniosacral techniques, and go back to the nervous system regarding the craniosacral output of the parasympathetic nervous system, you're going to see how we can shift the homeostatic mechanism, especially under the stressful condition, from the domination of the sympathetic nervous system to the parasympathetic nervous system. The third techniques actually is a visceral manipulation. Also, this is one of the osteopathic manual techniques when the structure no longer mobilized under stressful condition. So the skeletal system and the posture get disturbed, and the fibrous tissue around this skeleton replaced the elastic in this site of fear and flight. And when the arteries, nerve, which lymphatic system trapped in a stagnated line, so the illness is appear. So when you go and see how is the motility of the visceral organ, you're going to see also disturbed, which can also be fixed through the visceral manipulation technique. Also, in addition to this technique, we have what's called the muscle energy technique. And again, this is one of the manual technique. You use your hand to assess the muscles and how its energy through the tonic. By palpation, you see, is it through the normal tone, or it is hypertonic, or it is hypotonic. And according to the physiological phenomena of reciprocal inhibition and reciprocal facilitation, you can use this physiological phenomena in order to facilitate the joint movement and the muscle length and expansion. And also, you can relieve the pain, and you can induce the or regain the normal function. Also, another tissue we can work on it, which is the myofascial release technique. So the connection between the muscular tissue, and the fascial tissue, and the interfacial tissue also limit the movement of the muscle, and by turn is going to limit the movement of the skeletal system in terms of joint. And this limitation is going to affect the function not only of the musculoskeletal, but also of the internal organ. Another techniques we can use it also, which is called positional release technique. This technique, in addition to based on the the muscle spindle technique or the stretch reflex. How is the gamma firing during this extraordinary approach, extraordinary status which we live, can affect these muscles? So through putting the limb or putting the specific joint in a specific position, so we can reduce the firing of the gamma afferent, and then we can get the functional back depending on the position which the patient or which the person is going to maintain it for a certain amount of time. Also, we have a trigger point release technique. This trigger point, which happen due to many various causes, especially under siege now and the traumatic phase which we live now, either psychological trauma or the physical trauma or combined. So we can get many trigger points, and by releasing of this trigger point at different places, again, it is going to be diagnosed and treated through the manual skills. We have also mobilization technique. And again, this mobilization techniques, depending on the physiological barrier and the pathological barrier and the anatomical barrier. So depending on how far the dysfunction or disability of the joint and dysfunction of the human being, we can adjust the grade of mobilization in order to avoid any harm for the tissue and get negative result instead of to get the positive result. We have also what's called proprioceptive neuromuscular facilitation technique, aiming for strengthening and stretching the soft tissue dysfunction. This proprioceptive neuromuscular facilitation technique, we can use it actually in the neurological condition and orthopedic condition, which is going to use the phenomena called in the neurological phenomena as overflow phenomena. We're using the muscle which is still working and give this muscle a specific amount of resistance, so we can stimulate the output from the nerve root supply and let the weak muscle which affected get the benefit through this technique, proprioceptive neuromuscular technique. And depending on we are going to use this technique as a strength, there is many subcategories, either rhythmic initiation or repeated contraction and relaxation, slow reverse contraction, slow reverse hold contraction, or rhythmic stabilization. If we're going to use it for stretching, we have two technique: contract relax technique and hold contract hold relax technique. Thank you for listening, and if you have any questions.
I have a question. You practiced with me virtual diagnosis and virtual therapy, and it was successful. You remember this happened at least 3 times. So my question, can virtual therapy for acute painful conditions be practiced to people in Gaza or elsewhere? This is number one. And consequently, can virtual training for manual therapy be done? I mean, I believe in virtual training. Tomorrow I have a lecture about this. So as I said, you practice virtual therapy with me. And even you remember the last case, I was not the patient. It was one of my family members, okay?
Yes, regarding the question number 1 and the treatment of the acute trauma with manual therapy, there is very, very successful actually result, and you can get many benefits out of it. The only thing regarding the virtual manual therapy, it depends on not all the recipient is going to be like Professor Dr. Muhammad Yusuf. So it's going to need, at least a basic, as I mentioned, all the manual therapy techniques is depending on very deep understanding of our human being structure. So if you have one who understands where he's going to put his hand, is he's going to put his hand on the skin or on the subcutaneous, how much pressure you're going to go in order to affect the structure you intend to get it. So regarding the acute trauma and the acute pain, actually the cranial therapy, how you're going to use this cranial techniques in order to affect the dural tension, and once you get rid of this dural tension, you're going to see by the will of Allah subhanahu wa ta'ala a fantastic result.
Yeah, sure.
And this is immediately. You can see it immediately as you're working on the cause, the root cause of the problem.
Yeah, but really, I encourage you to produce some what you call some video clips, something like this, because it was really for my limited, humble experience with you 3 times very successful. It is not the matter that the patient was Muhammad Yusuf or someone who understands anatomy and physiology, but things may move bit by bit, really. May I ask you, Dr. Hatem, if you have a question, please put it on the Q&As, please. Any more questions regarding this valuable lecture? Okay, thank you so much.